Mark Butler, welcome to 7:30.
Thanks, Sarah.
One of the most potent campaigns in this election is obviously Labor's campaign warning that Peter Dutton, as Prime Minister, would gut Medicare. I'm just going to play a few examples of things that Labor has been saying. Just have a quick look at these.
Under Dutton, your health costs go up, he cuts, you pay.
Under Labor, you get free Medicare appointments. Under Peter Dutton and the Coalition, you will pay more.
There's no question your family will be worse off if Peter Dutton gets another chance to cut Medicare.
And affordable healthcare is the number one priority for people in our community. All this is at risk if Peter Dutton is elected, because we'll know he'll cut health funding, he'll close the Medicare urgent care clinic at Lane Cave.
Now, urgent care clinics and Medicare are not safe in Peter Dutton's hands.
And in case anyone's wondering, those cats at the end there are from Labor's official Instagram account. But the point is this: the opposition has matched your $8.5 billion funding for Medicare bulk billing dollar for dollar. So how is your campaign not misleading?
Well, as Malcolm Turnbull said yesterday, to use his words, the problem Dutton has is he has form in this area. He has a track record that he must wear. I mean, Peter Dutton was voted the worst health minister in the history of Medicare by Australia's doctors for very good reason. He looked Australians in the eye in 2013 as the shadow health minister, promised them there'd be no cuts to health, and then a few months later put a wrecking ball through Medicare, trying to abolish bulk billing altogether, trying to cut $50 billion from hospitals. And importantly, he's never sought to atone for that. He's never apologised. He's never taken Australians into his confidence and explained to them why he did that, and why he thought it was a good idea to try to Americanise Australia's healthcare.
And yet, Mark Butler, here we are in an election this year in which the opposition has said, and this was announced at the time that your own funding commitment was made, saying that he would match that $8.5 billion funding for Medicare bulk billing dollar for dollar. Isn't he entitled to have the argument about this campaign run on the merits of this campaign and the policies they've offered?
And I'm entitled to warn Australians of the risk of putting their most important social program in the hands of Peter Dutton again, because this is exactly what he did in 2013. He promised there would be no cuts, and then he betrayed Australians by putting a wrecking ball through the Medicare system. He's never sought to apologise for that. He's never said he did the wrong thing, and I'm entitled to warn Australians they are at risk of him doing exactly the same thing again. I mean, he said there would be cuts to pay for his nuclear program, his $600 billion nuclear program. He's said that over the last several weeks, but he's also said he won't tell Australians until after the election what they will be if he's elected Prime Minister.
Now, parties, however, are entitled to change their positions. It was the Labor Party who first froze the Medicare rebate, but more recently you went to the 2019 election promising changes to negative gearing, capital gains tax. Why can't the coalition change its mind?
Well, on the second thing, we have explained why we thought that that was the wrong policy, and we've discarded it. We've been open with the Australian people about that. Peter Dutton's never done that about Medicare. On the first, you're simply wrong about that, Sarah. What we did in 2013 was to change the date of indexation to the Medicare rebate to the 1st of July, to the beginning of the financial year. In 2014, in line with our decision, the Medicare rebate was indexed. It was going to be indexed every single year until Peter Dutton decided to freeze it for 4 long years, a position that was extended by Scott Morrison for another 2. So they are apples and oranges, Sarah. It's not proper to try and draw an equivalence between those two things.
Now, Labor has also equated cuts to the Federal Health Department that have been mooted by Peter Dutton, but you've equated those as directly as cuts to Medicare. But health experts say that many of those roles, those new roles added by Labor, are policy positions. Now, setting aside the value of that work, aren't you again misleading voters by suggesting those are frontline roles in Medicare?
He's made this mistake in Veterans Affairs, in a whole range of other areas, to pretend that hard-working public servants in the Australian public service don't have an impact on the services that Australians receive. They've done it again over the last couple of days. They've said they would abolish the Centre for Disease Control that we're in the process of introducing, coincidentally within a fortnight of the American DOGE system cutting a swathe through the American CDC, and it will have an impact on the Australian healthcare system. We know this was a central recommendation of the independent COVID inquiry. It will impact our preparedness, our capacity to deal with the next pandemic, and yet they try to pretend that there's going to be no cuts to health. It just goes to the heart of why you can't trust Peter Dutton in this area.
Your campaign also claims that the coalition will shut down existing urgent care clinics, despite the coalition repeatedly committing to retaining the existing urgent care clinics. Isn't it misleading then to say that they're going to cut the existing clinics?
No, well, the only thing they've repeatedly said about urgent care clinics is they don't support them. They opposed them when I announced them 3 years ago. Ever since then, they've used terms like a disaster, a failure, and most tellingly, Angus Taylor has repeatedly described our investments in urgent care clinics and other areas of health as wasteful spending that he intended to reverse, presumably to pay for his $600 billion nuclear power plant. So in 5 minutes before the election, suddenly they've had a change of heart that they can't explain in a coherent way. They're chopping and changing where they'll support urgent care clinics and where they won't, whether they'll be bulk billed or whether they won't, all led by a party, as I said, who's got form in this area, as Malcolm Turnbull said, who is entitled to be judged according to his past performance on health, which is an abysmal one.
But as things stand at the moment, I just want to stay with this point. They have categorically stated their policy on urgent care clinics is to maintain the existing clinics as they are. There is a debate around how many new ones will be built, but the existing clinics, they stay.
After 3 years of bagging them, after 3 years of calling them a disaster, after opposing the introduction of this important model of care to Australia, yes, at 5 minutes to midnight, just as Tony Abbott and Peter Dutton did in 2013, they're trying to weasel their way through this election, and they're entitled to be judged on the record, particularly Peter Dutton's record as Health Minister. And I think I'm entitled, as his opponent in this area, of warning Australians of the risk of putting the most important social program we have back in the hands of Peter Dutton.
One clearly differentiated policy in this campaign is the Greens calling for dental care to be included in Medicare for adults. What's wrong with free dental care?
Well, it was essentially a pragmatic decision taken by Bob Hawke and by Gough Whitlam before, that they couldn't fight on too many fronts. They were fighting doctors' groups, they were fighting the Liberal Party, they couldn't fight the dentists as well, who at the time were opposed to dental going into Medicare.
And bringing it up to 2025?
Well, in 2025, really what we face, and I've tried to be honest with people about this, is the need to deal with Medicare as we currently face it, turn it around, strengthen it, particularly rebuild general practice. But I also have said the Labor Party would like to see dental brought into Medicare over time. I've just tried to be frank with Australians that at the moment our bandwidth doesn't allow that to happen in the immediate future.
Mark Butler, thank you very much indeed for joining us.
Thanks, Sarah.